afternoon, Cedarfield family. I hope all is well with you here on February 26th at 3 o'clock. Happy Friday to you. Those of you that are listening tonight, thank you for taking time out of your busy Friday evening, or maybe even over the weekend, to listen to some information about Cedarfield. Our format is very simple today. We'll probably have a 25-minute live chat here. We have the following topics on our agenda. 1, talk a little bit about our Cedarfield situation. 2, talk about the COVID-19 vaccine distribution. 3, our COVID-19 evolving preparedness plan. And 4, a little bit of good news, some operational updates. As we move into our current situation here, our dashboard, I am just going to remind everyone that this will be the last live chat that I talk about a Cedarfield dashboard. It seems like for the last 2 weeks that the dashboard has been green across all levels of care, and rather than repeat this information every live chat, unless the information and the metrics change, we'll start back up another dashboard. But until that time, and hopefully we don't ever get to that again, this will be the last time that I go through, or actually, you know what, let's just do this. The entire community, the dashboard is green. No matter where you live or where you work, our dashboard is green. No pending tests, no residents under isolation, no residents under any quarantining measures. There are no team members that have any restrictions to return back to work. The dashboard is completely green. Can I get an amen? Amen. Thank you. So, if that dashboard changes, and let's pray that it never does again, we'll kick back up the dashboard and use the dashboard to inform residents and team members and family about our current situation. Let's dive right into our vaccine distribution. We had our 5th clinic yesterday. Renee Langley was at the helm, along with Matt Dameron, in organizing that 5th clinic. And that clinic provided the 2nd dose of the Pfizer vaccine for 83 people, which is just great news. Next week, we have our 6th and final clinic on March 5th, from 3 o'clock to 5 o'clock, right here in the Fellowship Hall. That is a 2nd dose only clinic, and that clinic will be for 34 people, and that'll round out 6 particular clinics that we have organized over the last 8 weeks. And that will conclude our plans as we know it right now with Walgreens to provide the vaccine right here at Cedarfield. If those 34 people come through next week with a 2nd dose, we will have a 91.5% participation rate between residents and team members here at Cedarfield. A little bit more about herd immunity and participation rates in a couple of minutes. In terms of our evolving preparedness plan, the Cedarfield management, along with the Pinnacle Living management, have affirmed a memo that our leading age partners have forwarded to the federal government. For those of you that aren't familiar with leading age, there is a national leading age organization based out of Washington, D.C., and then there's a state affiliate, in our case it's Leading Age Virginia, that represents nonprofit aging service providers. In total, Leading Age National represents over 5,000 not-for-profit aging services providers and other mission-minded organizations around the country that quite honestly touch millions of lives every day. And alongside of this organization, there are 38 partners in this endeavor. They use Leading Age Virginia and Leading Age National. They use applied research and advocacy, sorry, it's Friday afternoon, education and community building, really quite honestly to make America a better place to gracefully grow old. And so that's Leading Age Virginia and National. Cedarfield and Pinnacle Living are a member of that organization. They authored a letter that was sent to the federal government. I'm going to read you one of the paragraphs in that letter, to which we have affirmed. Quote, COVID-19 vaccines are the most significant development of this pandemic, and real progress has been made in vaccinating nursing homes, assisted living communities, and independent living communities. It is time for visitation policies to catch up. As cases have declined and the balance between caution and isolation has tipped, we are urging the federal government to revise formal guidance and reconnect nursing homes, assisted living communities, and independent living communities, and the residents who live in these communities with their loved ones, end quote. This letter was sent to the White House Domestic Policy Council, along to the Centers for Medicare and Medicaid Services, otherwise known as CMS. Some people just refer it to as Medicare. And this letter was sent to the Centers for Disease Control and Prevention, otherwise known as the CDC, requesting a series of policy changes designed to lower the barriers of not just visitation, but reduce all of the parameters and restrictions that they have requested that we implement over this last year. So we formally agree with this letter, and I share that with you because last week, or this week, is really the first week of a scaling back of COVID-19 restrictions with visitation and dining services. And we're kind of hesitant of taking a couple next steps until we really hear from the CDC and CMS to help guide us. And quite honestly, Virginia Department of Health uses the CMS guidelines and CDC to help here at the local level for us to make decisions. And so we, out of the gate in the last 2 weeks, we went on our own, quite honestly, with visitation and scaling back dining services. And we really are looking to the Medicare and CDC for further guidance. So if we don't hear from them in a week or so, I will provide, or either way, I'll provide an update during the next live chat of whether we heard from them and or what are our next steps in rolling back COVID-19 restrictions here at Cedarfield. The good news is we did start rolling back visitation last night, and because we do believe it's the right thing to do, given a lot of what we discussed on the last live chat on Monday. We gave everyone our rationale for doing that. And dining starts back on Monday. We're very excited to roll back in the Atrium Cafe, the Pub 2300, and the Cedar Grill for lunch and dinner starting next Monday. Very, very exciting. All of that to say that the public health preventative measures are still in place. So I know you all maybe perhaps like myself from time to time, feel really great that we're all vaccinated and we can loosen things up right now. Right now is not the time to really stop wearing masks, staying socially distant, or getting closer than 6 feet and loosening up your own infection control practices. Be the best that you can be a year into this and continue those practices to keep yourself safe. Speaking of vaccinated versus not vaccinated, I had the pleasure of talking with some epidemiologists this week at the Virginia Department of Health. I've been doing my own reading about vaccinated versus not vaccinated when you talk about the topic of transference of the disease. Renee and I have received many emails and texts and phone calls this week asking, as an example, I'll use the following example. I only want a housekeeper in my apartment that has been vaccinated. Or next week when I get to the dining room, I only want a server serving my table that has been vaccinated. So the question behind that request is it safe to be in front of people who are not vaccinated? So I've been doing a lot of research on this. In fact, I talked with, again, the epidemiologist at Virginia Department of Health. And here's my reply to that. A, it would be impossible for me to manage this community in getting people who are vaccinated to residents who have preference with a whole host of services and amenities. I can't even begin to imagine how we would even manage this community. But more importantly is the second reason, the rationale. If you are vaccinated, if you received the COVID-19 Pfizer vaccine or the Moderna vaccine, and you got both shots, you still can be a carrier of this virus as much as somebody who has not been vaccinated at all. There is not significant research out there to suggest one way or the other. But what we have been counseled on is that everyone can still really carry the virus. And so to that end, we're not making decisions here at Cedarfield based upon whether or not somebody's been vaccinated in terms of allocating services and amenities. We're just not going to do that. Hopefully that provides some clarity. If anyone has any questions about that, please feel free to stop down to the administration suite. 2 other items about our evolving preparedness plan. 1, if you have not received your Pfizer COVID-19 card, your validation card, your authorization card, please stop down to the concierge desk. Karen and the team still have a number of people and envelopes with those cards. And then last thing about our COVID-19 evolving preparedness plan. For those of you that typically leave the community, residents primarily I'm speaking to right now, residents who leave the community, for example, on a Friday night and then come back on a Sunday, we did have a process in place where that resident had to fill out an attestation form that they did not come in contact with anybody with COVID-19 and that they used all of the public health preventative measures while they were gone. And then residents essentially handed back this form into the front desk so that we can use that form as a contact tracing tool. That form is not applicable anymore. So for those of you that are traveling, particularly over the weekend or overnight, whether it's locally, regionally, or out of state, you do not have to fill out that form anymore. For those of you that have been doing it faithfully over the last 9 months, I want to thank you for doing it. It has provided great insight for us and a tool that we used often to help with contact tracing efforts. So that is our COVID-19 preparedness plan update. Just shifting to COVID-19 testing clinics. They're coming to a theater near you next Wednesday. Hopefully you have received a memo in your cubby box or mailbox, kind of just outlining the process that we're going to go through for testing here in the month of March. If you wish to do it, it's not a mandatory test, so please refer to that memo in your mailbox or cubby box for guidance as to when you would be coming to the fellowship hall to receive that, or actually the club room to receive that clinic. I think that's it about COVID-19. I just have a couple of operational updates. Number one, our fourth main phase to this master plan expansion, known as the household building, we received our temporary certificate of occupancy today, or Wednesday. Just a great milestone day, crossing that threshold with the county. It is called a TCO. What does that mean? It means they asked for a couple of other minor things that we need to do, along with the owner architect punch list that the general contractor needs to finish. That should take us into March 12th, those two items. And that building will be officially Cedar Field's building. So we're just so excited. I am not so entirely excited just for the building. What I am excited most about is that that building will enable us to truly take another step in a culture change effort to transform long-term care in the city of Richmond and be one with many people and many organizations that have taken this step, quite honestly, around the globe. And so we will receive the building officially on March 12th. We have some training we need to do in that building, effective March 12th through the middle of April. And then we're going to have a series of grand openings on the week of April 12th to give people a chance to tour the building and touch it and feel it and hear from some team members about how we intend to operationalize that building. So I am just so excited. I can't wait for the residents to take advantage of the service that's going to be in that building and the team members who will operate it. It's just, it's a great thing. It's a great step forward for Cedar Field. Which leads me into my next thing. This master plan expansion has 6 different phases, and so next Monday we are starting phase 5 of those 6 items. Phase 5 talks about renovation of the existing healthcare area. So officially the contract starts on Monday. We're partnering with a company called Oregon / Cornerstone. They are one and the same entity. It's a local firm, great general contractors, very high level of integrity, and their project management skill and experience. We have done our homework and we're just pleased to be partnering with this firm. And so they will help us through the next 2 years of this next phase. So next week, I will talk a little bit more about what that first phase is within this particular phase of the master plan. Next week as well, residents are going to receive a memo from yours truly to talk about paving, the next capital item on our list. We want to get paving, repaving as much done here in the springtime as possible. And so, for those of you that remember, a couple months back, we did some repaving in the court around those cottages. So this next phase of repaving is going to commence on March 15th. And in the memo I will publish on Monday, it talks about the timeline and the logistics around this next repaving plan. It has everything to do with the entire lane and all of the cul-de-sacs on the lane. And it has all to do with the parking on the east side of the building in and around the main building, from Parkview entrance, covered parking, all the way up to D-Wing. And so that project will commence on March 15th, and it will take us through March 23rd. So we've really done a lot of work in making sure the logistics are as tight as possible. So again, look forward to a memo in your cubby box and or your mailbox on probably late Monday afternoon that talks about the logistics of that particular renovation. Again, one more plea just for the cars that are parked out front of the main building here. Many of those parking spots are needed for visitors who are now coming. They started coming last night. If you have a car that's parked out front of the main building, that parking lot is meant to be a transitional space for people coming and going, and not a permanent parking lot. So if those of you that have a car out front, there's plenty of parking spaces over in and around the D-Wing entrance. Two little minor things in the grand scheme of things. What I have learned over the last couple of weeks about unwanted animals, otherwise known as rodents. I've learned a lot about those God-given creatures. One of the last things we need to do to protect this main building is remove bird feeders. I have come to learn through specialists that those little creatures love birdseed. And the seeds and or the food itself is in and around all of the main building, which is a next critical last step that we need to do in order to fight this battle. So again, next week we're going to make a big push to eliminate bird feeders around the community so that we can protect our community from other unwanted animals. And then next week is our first week where we are moving live chats to Wednesdays only. So you will, starting in the month of March, we will have a 3 o'clock live chat on Wednesdays only. Any frequently asked questions come in? We do have some questions. We have 3 questions that have come in. One talks about visitation in the in Sunshine, our memory care support area, our assisted living, and our health center. Do we still need to call to arrange for a visit? The answer, so visitors that are coming to see a loved one, a friend, a relative in memory support, assisted living, and or north, central, south neighborhoods, we do need you to call the neighborhood leader of those particular 5 neighborhoods and schedule your visit through the neighborhood leader for a particular day and time. This is one of those reasons why we've written that letter to CMS and CDC asking for some leniency on visitation. Those particular areas are heavily regulated by some of our federal government partners and state partners, and we really do need their guidance in helping us relax our current protocol. Until we do that, visitation on that side of the building has to be scheduled through the neighborhood leader, and the visitors have to go through a visitation vista in order to visit somebody on that side of the property. Can you explain affirmation home health again? I can explain it. So the question is, can you explain affirmation home health again? And I can do it, and I'll do it in a very succinct way, because we're actually, in the month of March, we are going to publish a communication education plan where we're going to really talk about what affirmation home health is and all the details of it throughout the month of March and into the spring, because it's a big topic. It strengthens the Cedarfield community along with Lakewood, and it offers residents so many more choices to pick and choose different amenities within this company to be independent and to help with your own well-being. But essentially what Affirmation, this company is, it's a joint venture between Pinnacle Living and Lifespire of Virginia. One of their campuses is right here locally, Lakewood. It's a great joint venture between two senior living partners to join forces on behalf of the residents that we serve. And so our primary focus in this joint venture is to serve the residents who live at our communities. That is the main driver, to get you quicker access and a better continuum of care around three service levels at a retirement community. One is called home care. Home care is a business model where CNAs and caregivers would come into your apartment, whether you're in independent living, assisted living, or a nursing home. They would come into your apartment and they would help supplement services that we offer here. They help with bathing and dressing and grooming. We call those instrumental activities of daily living. Within this business line, caregivers can do simple things as shopping for you and or walking the dog, to name some very few listed items that they can do. And so it's a private pay piece to this company where the resident would contract with Affirmation Home Care and again, supplement service. The second has to do with home health. Medicare has provisions to provide home care services under Medicare Part A. And so if a resident unfortunately needed skilled level of care, meaning an RN, nursing services, where they would qualify a PT, an OT, or a speech pathologist to come into your apartment or cottage, whether it's independent living, assisted living, they have authorization to come into your own setting rather than you needing to go to an outpatient therapy clinic. They come to you, home health, into your accommodation. And they provide therapy or nursing services right in your own home. That's the second piece to this organization. And then further down the line, the third piece will be hospice. We will develop under this umbrella, under this Affirmation Home Health, again under Medicare Part A services, we will develop our own hospice program. I am so excited for this joint venture to begin, because it allows the management of Lakewood and Cedarfield to work in tandem with the resident to provide a better level of service. You can use the services as a short-term basis or on a long-term basis, whatever the situation requires. So again, I'm really excited about it. Then the last question is, are new moves into Cedarfield required to be vaccinated? And the answer is no, they're not required to be vaccinated. We have not made it mandatory for any resident and or team member to be vaccinated. The last question here is, can Cottage residents have bird feeders? And I'm not quite sure of that answer, so let me do some research on whether or not that's permissible, given the other situation that we have in our hands that we really need to get further under control. So I don't see any other questions, so thank you for listening and tuning in to this 32-minute live chat. If anyone has any questions about the details within this live chat, please feel free to call down to the administration suite. I hope you all have a great Friday evening and a better weekend, and we'll talk with you soon. Thank you.